You're watching the Fox 5 Morning News at 7.
A live look from our Balboa Park camera, 7:40 on this Tuesday. You got sunshine headed your way. It's going to feel nice today. 7:40, chloroquine. You have heard this. Chloroquine is one of the drugs promoted as a way to treat COVID-19. Dr. Richard Chaffoo is joining us now with the concerns doctors have about using that drug. Dr. Chaffoo, good morning and good to see you.
Good morning, Shally. Good to see you too.
We have heard so much about this, the chloroquine, hydroxychloroquine over the past few weeks. Both studies from doctors saying that this could be what we need. But there was also a research trial just done in Brazil that the findings are a little alarming. Tell me a little bit about it.
They are, Shally. And the thing is, it was a study on a very small number. I think we want to emphasize 81 patients. And in that study in Brazil, they divided the groups into two groups. One group was getting chloroquine at a dose of about 450 milligrams twice a day for 5 days. And the second equal group, about 20 patients, were getting 600 milligrams twice a day for 10 days. At the end of 3 days, Shally, they found that a significant number of these patients were getting heart arrhythmias, serious heart arrhythmias. And in fact, by day 6, 11 patients had died from, presumably from these fatal arrhythmias, and so they stopped the study. So I think it's very important to realize that this was not a very well-controlled study. There was no placebo, there was no control group in this. And so it was a small series of a small number of cases. And also, Shally, it's important to remember that really in the U.S., we don't use chloroquine so much. We use the safer form, hydroxychloroquine, which is called Plaquenil. That's been used a lot in lupus and rheumatoid arthritis, but at significantly lower doses than the Brazil study. So this may be partly due to the fact that they were using very high doses of these medications in these patients.
And these medications, obviously, they were not created to treat COVID-19. Doctors are trying to pull. I heard a Dr. Chaffoo in Los Angeles, I think it was just yesterday, saying that the combination of the second one that you just mentioned with zinc, he was finding was actually taking away symptoms of patients who had COVID-19 within up to like 12 hours. So how do you make,
I'm sorry, you make a great point there. And that's important to remember that the drug, the mechanism of action, these drugs were originally developed as anti-malarial agents. But the way that scientists feel like and researchers feel that they may work is, especially hydroxychloroquine, which we use, somehow opens the gate to allow zinc, which is an extracellular element, to enter into the cell and prevent the virus from replicating. Because remember, this virus just can't survive outside of a host. So if you prevent it from replicating, from reproducing itself in mass numbers, then essentially you eliminate the disease. Now, what was also interesting in some studies, they found that people that have lower levels of zinc, older people, people with heart disease, diabetes, obesity, hypertension, cardiac disease, are more likely to have a worse outcome from COVID-19 than those people that have relatively normal levels. So like your researcher was saying in Los Angeles, if you add zinc to this hydroxychloroquine, it might be that combination that does seem to reduce the symptoms and help with this disease process.
He said that the symptoms were disappearing between 8 to 12 hours when he's been prescribing these two in combination.
Together.
So one of the things, Dr. Chaffoo, with this whole asking everybody to stay home and the social distancing that we're doing is to be able to buy our doctors and our scientists time to see if these work. How long do you need to be able to do these studies? Like if they saw in Brazil, this chloroquine's not working, they stopped it immediately. How long do you need to be able to say this may be it?
So you make a great point. And the thing is that that research takes time. It takes repeated study, large numbers. You know, it's prima non nocere, first do no harm. So we're better off not just rushing to a treatment unless we have got evidence. And that literally can take many months. You know, creating a vaccine can be, you know, I think the last thing I heard from the CDC was that it took about 4 years to develop an effective vaccine for mumps. So this is a long-term process. We don't want to rush to treatments because while some of these medications are very effective for other disease processes, we want to make sure that we're not harming a patient. We're using the right dosing, and we understand why we are using it specifically. What is it doing to help with this disease process?
So this chloroquine, now that this this study that came out of Brazil, and it showed this study that some patients were experiencing heart problems, will other hospitals pay attention to that, even though it was done with just a small group of people, and then they stop their study and take that information into consideration?
Absolutely. And the important thing, I think, for the public to realize, again, it wasn't a well-controlled study. They were using very high doses of these medications. They're safe in lower doses. The other thing that we don't know, Shally, is the cardiac effects of the COVID-19. Are they a direct effect of the virus? Is it the body's inflammatory response? You know, there was a large study done in Wuhan where this virus initially started of over 400 patients, and they found that people that were that had underlying cardiac disease, their mortality rate was significantly higher than those that didn't have cardiac disease. And they weren't sure, well, was the cardiac disease due to the virus itself, or is it due to the inflammatory process? So there's a lot that still needs to be worked out about the disease process, what's really going on, and trying to find out what drugs are most effective and at the same time safe for patients.
Yeah, we know got the smartest people on the planet working on this right now, and I'm hoping one of these days I'm going to walk in here and they're going to say, Shally, there is an answer. Dr. Chaffoo, thank you for being here.
Good to see you.